15 years old, patient with pectus excavatum, sunken chest. You can see the deformity, how sunken is the breastbone. So this is called the pectus excavatum, the sunken chest, and we do the Nuss surgery for correction of this deformity. Hi, I'm Professor Dr. Erkan Yıldırım. I'm a thoracic and a lung transplant surgeon. So here you can see how the breastbone is sunken from lateral side on the chest CT, and in the 3D images you can see the breastbone highlighted, how depressed it is. And in chest CT we calculate the Haller index, which is a deepening index. If it's over 3.5, then the surgical indication is existed, and we planned and started to do the surgery. So here in the operating room, the patient is lying back on spine, and we check for the distance between the breastbone and the heart. It's very important to pass there safely, because we are gonna insert the Lorentz bar, which will be introduced under the breastbone and get on the other side. And the Nuss bar is prepared like a C shape according to the patient's deformity. As you can see here, my assistant is shaping the bar according to the template taken for individually for each patient. And when it's done, then we start to insert the Lorentz bar under the breastbone over the heart, and get on the other side and get out from there. And then we turn the C-shaped forward, the C-shaped bar forward, and it corrects the chest wall deformity. You can see the bar on the chest X-ray, how it is seen, and here this is the images after the surgery, and you can see how it's corrected nicely and very well. So please do not hesitate to contact us. We will be very happy to help you.